information about Kelly Hurley, and then we'll go ahead and turn it over to her. Thanks for joining us.
Thank you so much for having us today and for that gracious introduction. I'd also like to introduce Aaliyah Johnson. She serves as community outreach coordinator for the C.W. Williams Community Health Center. And in that role, she oversees various services, including HIV testing, the mobile unit program, as well as health insurance enrollment activities. So I thank Ms. Johnson for setting this up with the library, and we appreciate your having us today. So if I can share my screen.
Absolutely.
Okay. I don't know if everyone can see that.
We can.
Okay. From beginning.
Always a good place to start.
Yes, sir. So as you mentioned, the C.W. Williams Community Health Center was founded in 1981 by Dr. C.W. Williams and cohorts. They petitioned the federal government to establish a community health center that would serve the underserved populations in the greater Charlotte area. We are a private 501c3 not-for-profit federally qualified community health center, which for short FQHC. We have a board. We're governed by a board of directors, as well as we seek input from community partners who help us make sure that we assess community needs and address those needs appropriately. As an FQHC, we are part of a national movement that was started back in the 60s, late 60s, early 70s, to provide community health centers in low economic and poverty-ridden areas, primarily in the South, Florida, Mississippi, Alabama, serving the rural areas and migrant workers and farmers who did not have access to high quality health care. So the government, in all of its wisdom, founded the community health movement, and now there are thousands of community health centers nationwide serving approximately, I believe, like 20 million people. So we are a force. As a community health center, we are a safety net organization, meaning that we provide wraparound services and point of care for primarily uninsured and underinsured individuals. So our payer mix includes people who are on Medicaid, people who are self-pay, who have no insurance. We do have private patients who have private insurance. And on average, we serve nearly 13,000 patients every year, representing approximately 23,000 patient encounters. So our mission is to improve the spiritual, physical, and psychosocial status to residents of Mecklenburg and surrounding counties, providing access to the highest quality comprehensive family health and ancillary service to all, regardless of their ability to pay. So as a part of providing all of these services, not only medical services, we have a full service dental suite, dental clinic at our main facility on Wilkinson Boulevard. They do preventive and primary dental care. And on the medical side, it's also primary and preventive care, in order to make sure that we treat all people, all of God's children. We offer payment on a sliding scale for those who are self-pay. On the medical side, the sliding scale is based on income, and family size. On the dental side is also based on income and family size. However, on the medical side, it's a flat fee. So we have different categories, A, B, C, D. On the dental side, there are different categories, but the payment is based on the total fee. Dental is a little bit more expensive, but we work, again, in partnership with many community-based organizations and governmental entities, including Mecklenburg County. Currently, well, I'll get to the next slide. Here are our services. So our goal is for families and individuals to come to our center and be able to access everything they need. If we don't provide it, we provide referrals to specialist providers. So, you know, you need to see a cardiologist or a podiatrist or orthopedic surgeon. You know, you come in to us for your primary care and we can refer out for those services. So here are all of our list of services. Under the behavioral health, we do have mental health counseling and substance use disorder counseling and treatment, including medication assisted treatment, or MAT, M-A-T. You know, really that helps to address the opioid issues that has been prevalent in our communities. We have an on-site 340B, which means it's subsidized pharmacy, so that patients come in, they have a very, very small nominal copay. We also work with MedAssist to make sure that patients receive all the medications that they need. We have pre-exposure prophylaxis program, or PrEP, which is part of our HIV prevention program and part of Mecklenburg County's Getting to Zero / ending the HIV epidemic. So PrEP is a medication therapy that we offer to high-risk patients. Those persons who may be IV drug users, multiple partners, MSM, meaning men having sex with men, and victims of abuse. So it's a pill that you take, and it's like 99% effective. So even if you are exposed to the HIV virus, you will not contract HIV. You may have seen the commercials on TV for Truvada and Descovy, which is the medications by Gilead Sciences. So we have a very strong HIV and STI program. We provide health education. Ms. Johnson is a part of our diabetes program. So as it's really a community health service that we provide diabetes education to the general public. We have an on-site food pantry, which actually has been suspended temporarily as we are undergoing construction. And that area is under construction right now. Again, I mentioned that Ms. Johnson is over our outreach department. We have on-site case management for both medical purposes, as well as case management addressing social determinants of health. So if you come in and we assess you and you have food security issues or transportation issues, financial issues, we can plug you in to resources to assist with that. We have on-site health insurance enrollment assistance. So now we're in open enrollment. Ms. Johnson can fulfill all of your needs. We also are trying to connect children to healthcare so that they can have the CHIP coverage. We want to make sure all of our children are covered. And over the last year, we have been heavily entrenched in providing COVID-19 testing, contact tracing, and vaccines. We've partnered with the county early on to give vaccines, and we've held multiple testing events out in the community, working with faith-based organizations and other community partners. We've given over 15,000 tests and approximately, I'd say around 2,000 vaccines. So if you need anyone who needs a test or a vaccine, currently vaccines are by appointment only, but as you all may know, the governor and the nation is moving towards just walk in for vaccines. So we may consider that as well, just to improve access and remove those barriers. Okay, so I'm going to toss it to Ms. Johnson and let her talk about, since we're now in open enrollment, talk a little bit about our insurance services that we provide.
Okay, so for individuals that do not have health insurance, CW Williams does have trained staff members that can assist with figuring out the best coverage options for you and or your family. So as Ms. Hurley mentioned earlier, we do offer a sliding fee scale for individuals without insurance that is based on their household size and income. And then we also have trained staff members to assist with Marketplace, so Obamacare, health insurance enrollment, and also Medicaid enrollment. So right now, under the American Rescue Plan, President Joe Biden has reopened the healthcare marketplace. So originally the marketplace was only open from November 1st to December 15th. So if an individual applied for insurance outside of that time frame, they did have to have a special qualifying life event. But right now that enrollment is open to everyone. So individuals who are looking for private health insurance are more than able to come in, and we will screen them to decide if it is best that they complete a Marketplace application or a Medicaid application, and our staff members will assist with those applications. So we will actually complete that application for the patient, enter in all their information, and make sure that they are well-versed in the application process, and will help them along the way. So in addition to Marketplace, as I mentioned, we also provide assistance with Medicaid enrollment. So Medicaid enrollment is open year-round. However, North Carolina Medicaid has undergone a change called Medicaid Managed Care. Under that change, patients will still have the same covered services under Medicaid, but will now have the option of choosing a primary care provider and also a primary health plan. So there are 5 health insurance companies that are offering plans under Medicaid. Those 5 companies are Healthy Blue, Carolina Complete Health, AmeriHealth, United Healthcare, and WellCare. So what we do during that process is patients will come in, we will walk them through all of the plans, help them choose their provider, and also help them with choosing a health plan. So unfortunately, this enrollment does end on May 14th. So we are encouraging all patients to go ahead and schedule their appointment as soon as possible, because starting on May 15th, the state will auto-enroll individuals that have Medicaid in a plan. And there is a grace period through September 15th in which people can change their plans and their primary care providers. However, after September, you will be locked in for the next year. So if anyone has any questions about their health coverage, what is their best option, they are more than able to schedule an appointment at CW Williams with one of our trained staff members.
Awesome.
Thank you so much, Ms. Johnson. We appreciate that. This is the Medicaid Managed Care is new for North Carolina. Other states already have it, but it's new for us, and a lot of people are confused. It's confusing. They don't know how to, when they go in to pick a provider, they don't understand that, you know, you have to select your insurance carrier as well as your provider. So we're here to help them navigate through that process. So CW Williams is celebrating 40 years of service to the community this year. So we will be having our annual virtual fundraising event, which this year will be virtual in October. And we are just forging ahead on many fronts. We have a mobile unit for medical and a mobile unit for dental that we've recently acquired, and having them upfitted and make sure all of the equipment is in place there. And then we will be launching these services so that we can touch those people in hard to reach and underserved areas, rural communities, communities that may be in a provider desert. We'll be working with community partners. So for instance, if the library wanted us to come and bring one of the mobile units to one of your sites, we'll be more than happy to do that. And we can do medical screenings, you know, they can do all types of dental services. We can do testing and all kinds of screenings for HIV, for COVID, we can do vaccinations. And so we really want to utilize that, the mobile program to its fullest capacity in order to serve as many people as possible. We want to make it convenient for the elderly, for the disabled, for disabled veterans, for people in assisted living who may not be able to get out into the community or come to our facilities. So we're very pleased and proud to be able to offer that service to the community. We also will be opening new sites in Charlotte. We have a site on Clanton Road now, and we'll be opening another site soon on the south side of Charlotte. We also work in partnership with Enlivian, formerly Charlotte Housing Authority, wherein we have clinics inside their facilities. We have a clinic inside Charlottetown Terrace on Baxter Street. That is a facility that is comprised of disabled residents. I think it's like 160 some people there. So, and we want to make it convenient for them. So instead of going out, having to go out for a medical check or a well check, or if they feel sick, they can go to the 11th floor and receive services right there on site. And we soon will be opening additional sites in partnership with Charlotte Housing Authority.
May I ask a question?
Sure.
Oh, yeah, yeah. Just quickly, you're talking about that medical mobile unit and
Yes, sir.
mobile medical and dental unit. Yeah. How large is that? Just curious, is it like, any idea how large that is? Or?
Well, I do have the dimensions, but they're not fixed in my head, but they are RVs that have been upfitted. So it's the size of like a Winnebago, a large RV vehicle. They're both about the same size. They're RVs that we have upfitted for the purposes of medical and dental care.
Okay, thanks.
So that really concludes our presentation. And we, again, thank you so much for having us today. We are located at 3333 Wilkinson Boulevard in our original site on the west side of Charlotte. And we have our phone number is 866-CWW4U, which translates to 866-299-4968. For appointments or a lot of services and programmatic information, you can visit our website, which is www.cwwilliams.org. So again, we appreciate this time to present to you all. And, you know, Ms. Johnson is available to come to your library sites, you know, to talk about open enrollment or set up a little booth. I know with COVID, I don't know what the traffic flow is like, but you know, we could be outside with the table or something and have information at any time. And then again, we'd also be happy to work with you to schedule one of our mobile units to come to any of your sites. So thank you so much again. And I don't know if we have any mothers on the call, but happy Mother's Day to all mothers out there.
And is it pivot to the attendees if they have any questions now?
Questions can also be shared in chat too, if you prefer to do it that way. So we'll offer that as an option.
Yeah, and I would actually like to ask, so how's the past year been for you guys with the pandemic? How big of a disruption was it to to the services? I mean, I can't even imagine.
Yes, it has been an interesting year. We, early on, our CEO had us wearing masks. Like when the pandemic first hit, everybody was masked up, gloved up. You know, we're walking around in masks and people are looking at us like, you know, what are you doing? But now it's, you know, it's commonplace. We have seen a reduction in our in-person patient appointments. You know, a lot of people early on felt uncomfortable coming to a health center, in fact, just leaving their homes. So we have truly offered telehealth. We've ramped up our telehealth services and so that patients can be seen from the comfort of their home, just for like routine checks and well checks, et cetera. We have seen an uptick in our mental health and substance use patients. I mean, it's been a rough time for everyone. So behavioral health has been very busy. And we've had to modify our schedules. Sometimes we've asked patients to wait in their cars until they're called. At one point, when the pandemic was at its highest, and at the height of the pandemic, we had drive-through clinics so that people, you know, who didn't feel comfortable coming inside were able to just drive through, go in a tent, or just talk to a physician from their car or a provider. So it has changed the landscape. COVID-19 has changed the landscape of healthcare, but we, fortunately, CW Williams did not close its doors. We were open the whole time. Our dental clinic was open the whole time. I know a lot of dentists shut down because, you know, dentistry is in your face. So a lot of the dental clinics closed. We did not. We stayed open. So, because that's what we're here for. We are here to serve the community in good and bad times and rough times. And really the rough times is where we shine, because that's what we're trained for.
And I imagine with some of the services, like perhaps the behavioral health, that kind of thing, I'm sure a lot of the practices that you guys enacted because of COVID, some of those will probably just remain indefinitely, because almost every organization we talk to, you know, there's usually a silver lining, something that they've discovered that may make things more convenient going forward, you know.
That is true. Yes. So our behavioral health was in existence before COVID. It will be in existence after COVID, but we're busy right now, and we want to make that service available. We also, our outreach department had to suspend some of its activities. For example, we provide free patient transportation. So we will come pick you up and take you home. We'll deliver your medications. So that service has been temporarily suspended, but we hope to have that back up and running in the next month or two.
Okay. We have a question from Florentina for you guys. She's asking, do you also provide enrollment services for Medicaid eligible clients?
I'm gonna let Ms. Johnson address that one.
Yes, we do. So we provide enrollment services to all. So whether you are eligible for Marketplace or Medicaid, if you are eligible for Medicare, we can connect you to SHIP, so the state health insurance program, so that you can get connected with that. But yes, like at CW Williams, we do provide services for Marketplace and Medicaid, and specifically we do and under Medicaid, we also assist children. So we have a program so that we can provide access to care for children. So we are working to make sure that all children in Mecklenburg and surrounding counties have access to care through health insurance.
Okay, awesome. That answers your question, Florentina.
Yeah. I'll go on. I actually have a few questions. In general, how would the immediate area around the community health center be described? Where is the community? Where is the center set? What type of community is it? Said it's in West Charlotte.
Yes, we are in West Charlotte, along the West Boulevard corridor, which you may know that in Charlotte, the county has identified a crescent shape of communities, and we're in that band of low income communities where there's low education attainment, low economic income, and I think the median income ranges from per individual per capita is $20,000 to $25,000, which is, as you know, that won't even pay rent. So it's a food desert for sure. Our staff all the time talks about that there's no healthy food around. There's Bojangles, there's Popeyes, there's churches, and you can't hardly get a good salad or a healthy meal. So it's difficult when we're talking about nutrition, and a lot of our patients suffer from chronic diseases. We have high hypertension, high diabetes rates, high populations that are obese. We try to talk about nutrition, but it's hard to give viable solutions when you're in a food desert. So we have to get creative. You know, we're even talking about using our mobile units for food pantry, for mobile food pantry. You know, that's an idea. And how do we address those social determinants of health that are really issues in our community where we're located? We're not just a health center, but we're trying to address all of those factors that impact the health status of an individual. And you know, seeing the doctor is in the bottom 30% of impact. So, you know, if you don't eat, if you don't have access, if you don't have transportation, you know, if you can't feed your family, you're not worrying about going to the doctor. So we're trying to address those issues that will make it easier for people to come to our center and be seen for illnesses that could be life-threatening.
Okay, well, great. Yeah, yeah, I was actually going to ask about the food situation too, and specifically about helping those who are patients who do come and who really do have a situation where they just don't get enough to eat even, or of course don't eat, you know, really a good diet, don't have a reasonably good diet.
Yes, so our case management team, we are a member of the Charlotte Resource Hub, Community Resource Hub, which was founded by Atrium Health. They use the Aunt Bertha platform, and it really is a database of all, well, I won't say all, but a large majority of organizations in the community that provide health and human services. So, and it's free to the public. Anybody can go on the website, but it helps us locate resources that are convenient for the patients, you know, geographically convenient.
Okay. Is there kind of like a typical patient profile for those who come to?
I would say greater than 80% of our patient population, is probably closer to 90, are minorities, mainly African Americans. We have a large Latino or Latinx population, as it's called now. We have a lot of Spanish speaking staff. So if you call, the front desk speaks Spanish, the providers speak Spanish. So we have a lot of Hispanic patients. We, you know, that's, I would say, and Caucasian patients as well. I said those are the three main categories. And then, you know, we have some Asians and Pacific Islanders as well. But I would say that the majority of our patients are low income. Medicaid, well, I'd say maybe less than a third are probably Medicaid, but many are uninsured. Right now, you know, due to the pandemic, a lot of people lost their jobs. They don't have health insurance. So right now we're at 75% uninsured. And that's huge because, you know, where do these people go for healthcare? Well, they can come to us because we're going to see whether you have insurance or not.
Yeah, I was going to ask if there was any kind of demographic change in the past years.
Yes, the uninsured has gone up. Our homeless population, you know, it's hard to tell. I know the county does those one-day census where they measure homelessness in the area. And I'd say our homeless population right now is, it typically turns around 14%, but it has probably gone up. But we have not polled or assessed, or, you know, we really haven't wrapped our hands around how many are really homeless right now.
With areas like Tent City, I mean, it's very obvious to anyone just driving through the city what's going on right now in regards to the affordable housing crisis.
Yes.
Yeah. Let me go ahead and ask about another population too. Glad that we're getting to all that. Are there special considerations given to, and I'm sure there's an effort to reach these patients, the LGBTQ population, or patients rather, I should say?
Yes. We, with our HIV and PrEP program, we have a very soft place in our heart for the LGBTQI community. We have what we call outreach in non-traditional times and non-traditional locations. So, you know, pre-COVID, we were out in those areas, nightclubs, barbershops, you know, where that population hangs out. You know, we have staff members and board members who are members of that community. So we're very sensitive to their needs and that culture. And, you know, we have staff training around sensitivity around cultures and LGBTQI issues in the community. So yes, we do reach out to that, intentionally reach out to that community. Yes.
I have a question from Florentina. She's asking, how do you volunteer?
So if you would like to volunteer at CW Williams, you are more than welcome to send your resume to my email. So I will drop my email in the chat, and I will make sure that it gets to our HR director so that she can get you connected, because there is a process. So our volunteers do have to go through an orientation. So I will make sure, like I said, I'll drop my email in the chat, and that way I can pass that along to the appropriate person.
And with regards to other things, you said the pantry is temporarily on hold while you do some construction. And you said your annual fundraiser is this fall. Is that correct?
Yeah, I'm not sure if Ms. Hurley's able to answer, but yes, our annual fundraiser. So every year, typically in March, we host a women's health and doctor recognition luncheon. So last year, of course, we had to cancel it due to COVID, but this year, with it being our 40th anniversary, we decided that we wanted to do something special. So it is still going to be a luncheon, but it is going to be held in the fall, and it will be a virtual luncheon. So we will have special guests, keynote speakers, and we will feature testimonials from patients in the surrounding community. So it is an event highlighting the work that CW Williams has done and where we are going in the future.
Awesome.
Right. If I may ask another question or two. I guess I'll make it specifically about the center's website. There's a great bit of information there. What tends to be most vital for the customer that goes to that website? It seems like there's a lot that jumps out to them.
So I'm going to defer to Ms. Johnson for the remaining of the meeting. If you have any additional questions, you can feel free to reach out to me or Ms. Johnson. And again, I thank you all. I'm gonna have to start another Zoom meeting. I'm the host, so they're waiting for me. I apologize for that. But again, thank you so much, and I hope you have a good weekend.
Thanks for being here,
All
Kelly.
right, thank you.
All right, I'm sorry, can you state that question one more time for me, please?
Sure, yeah. There's a lot of good information at the center's website. What are some of the most vital things that customers should look for when they go there?
So the main reason people, like the main points of our website, of course, we want to highlight all of our services. So there are many services that CW Williams offers. Like we said, well, like Ms. Hurley said, we are essentially a wraparound, so a one-stop shop for all of your healthcare. So definitely encourage patients to look for all of our services. And then there's also a form so that you can register to be a patient. And then that will get you connected to our staff so that you can schedule your first appointment.
Okay. Are there any things on the website that might possibly be dated or even out of date at this point that you could just tell us quickly? Don't worry about that.
So as far as anything that is dated, we do try and keep our website up to date. I think that we do need to update our care providers, but for the most part, our website is up to date as far as like events and our leadership team. So that is pretty much up to date.
Okay, great. Okay, thanks. Also, let's see, there was a letter from the CEO of it's actually the center CEO, Deborah Weeks, in a public message, The Blight Upon Us, that's the way it was entitled. And it seems like pretty much COVID is the big, big urgent concern. Has anything changed from that January message from her to the public?
So the only thing that I can say has changed, we are, of course, moving back into like more of our medical appointments. So people are slowly but surely starting to come back to the center to receive their routine care. But COVID is still the forefront of our push right now. So as you know, we are working to provide the vaccines to as many people as possible. So that is by appointment only. So we are, of course, still fighting to get people vaccinated prior to this June 1st reopening date for North Carolina. But that is still our main goal, but we are still, like I said, we're working towards getting patients back in to start receiving their routine care as more people become comfortable with coming outside again.
Okay. Also, how does the center promote itself in general as far as with the public?
So with promotion, we do have various ads around the city. So there are billboards and we do have commercials on Spectrum, but a lot of our promotion comes from word of mouth. So based on experiences that people have at our center. And then also we join in a lot of sessions like these where we are able to sit and talk about what our center is doing, where we have been and where we're headed. So that is how we do a lot of our promotion.
Okay. And I hate I didn't get this into Ms. Hurley earlier, but as far as donor funding, how does that go? Or do you get to participate much with that as far as, of course, the center being a nonprofit?
So, I mean, donations are always welcome. We will never say no to a donation. And we do have various events throughout the year. So our biggest fundraising event is our luncheon. So the one that is coming up in October is our big luncheon. We are promoting the 40 for 40. So we are our goal is to raise $40,000 for our 40th anniversary. So if you guys would like more information about that, we will be happy to share that information. And then we also host an annual health fair. It's back to school community health fair for children. So last year we did offer a drive-through setting, but we offer back to school and sports physicals for school-age children at a discounted rate. That way, you know, if they are participating in sports or before they go back to school, they have their physicals. And then we also provide book bags that are filled with school supplies for that event for the children who attend. So we do accept donations for that event as well. And then of course, just general donations.
Okay. I do have another question or two possibly. Let's see, does anyone else have a question or comment? Okay. Well, let me ask you this, and did just want to ask, and this is something that was brought up in the, again, in the CEO's message, just talking about a number of the patients that come there, of course, she actually writes about the COVID situation, and she says, any group living with systematic racism is subject to higher levels of social, psychological, emotional, and physical stressors, thus increasing chronic disease states. And I just wanted to ask, is that something that's ever shared with patients when they come in, or considered with patients, situations of where they might have stressors specifically related to issues involved with race or racism?
Yes, so that is something that is discussed with patients. So primarily with our behavioral health team, they will discuss issues that come from systematic racism or inequalities that they may face. That is something that our behavioral health team is working to discuss with them. And then our case managers will also help with connecting them to resources so that we can help to reduce those inequalities.
Okay. All right. Thank you.
You're welcome.
Mm-hmm. All right, let's see. I was trying to look to see if there's any other questions or comments. Anyone else? Anyone else on the team, or Florentina? We're glad to have you this morning. Any other comments or questions? I would just say that everyone should take a look at the website, and they will see a lot of good information there. And I think even general information that's just about, you know, general good health, which is good to look at. Okay.
And I want to thank you again for being here, Aaliyah, and feel free to follow up with us maybe sometime before the annual fundraiser. Feel free to do that, and definitely interested in regards to partnering with the library for some of the mobile services. And it seems like that should be something hopefully that we can do once we're at the next stage of accessibility with the pandemic. So
right, yeah, we have our our areas too of being careful. So yes.
My chat was disabled, so I just wanted to thank everyone for this opportunity to hear about your services. I wish I had learned about it sooner, but I'm glad that I've learned it now. So thank you so much.
Thank you. And my chat was also disabled, but my email address is A as in Apple Johnson. So my first initial and last name at CW Williams. So that's 2 W's.org. Thank you.
Okay. All right. Okay. And thank you for helping to set all the so much of this up, Leah. Really appreciate it. Thank you.
yeah, I'm truly impressed by all the services that you guys offer. I'm sure you have a staff of thousands.
We do our best to provide as many resources and services to the community as possible, because we know it can be hard and very challenging if you have to go from one place to another to receive your services. So it just makes it easier when people come in, they can essentially get almost everything that they need done at one time, and then they're free to go about their way. So we try and make it as easy as possible for the public.
That's great.
And I want to say thank you guys so much for having us. So Shirley did have to jump off, but again, we would like to express our thanks for having us and being able to shine a light on C.W. Williams.
Thank you once again for being here, and hope to check in again with you soon.
Exactly. Yeah. All right.
Have a good day, everyone.
Thank
You
you
too.
so much.
Thanks for joining us.